Welcome to the Deep Dive, the place where we take complex sources, articles, research, academic papers, and, we strip away all the jargon and get straight to the essential knowledge you need to be thoroughly informed. Today, we are undertaking a deep dive into a subject that is, well, it's constantly shaping policy, it's driving culture wars, and yet it's fundamentally misunderstood by so many people. We're talking about the construction and biology of gender.
Yeah.
We're going to be meticulously pulling apart the crucial differences between what is, biological fact and what is simply a societal expectation. To start, I want you to try a quick thought exercise, one that our source material asks all of us to consider.
Okay.
Try to recall the first moment you consciously experienced your own gender identity. Can you pinpoint a specific age or a situation where you decided to act in a gendered way?
It's a great question, and for the vast majority of people, the answer to that is just a definitive no.
Right. You can't.
You can't pinpoint a moment because there was no conscious decision. And that lack of memory, it isn't an accident. It's because the process of socialization, that immersion into a gender role, the application of all those norms, it begins literally the second you are born.
And sometimes well before that.
Often. Well before, absolutely. And our sources for this deep dive, they're rigorous academic texts that explore this critical and, frequently confused distinction between biological sex and socially constructed gender.
And the core mission of this deep dive is, I think, pretty ambitious. We're aiming to tackle the question of how we move beyond these limiting, rigid, binary concepts of masculine and feminine, male and female, that society still clings to so tightly. We're really looking at the evidence that overwhelmingly argues for a spectrum approach, both in biology and in sociology.
That's right. Over the next half hour or so, we will clearly define what the construction of gender even is. We'll tackle 4 common and, frankly, deeply harmful myths that just pollute this discussion.
Yes.
We'll explore the surprising complexity of biological sex, which, science shows is far messier than the simple MF dichotomy we all assume. And we'll discuss the significant harm caused by things like medicalization and marginalization.
And then finally, we'll look at the sociological theories that explain how we do gender every single day.
Exactly.
Our goal for you, the learner, is simple. By the end of this, you won't just have a list of definitions. You'll have a comprehensive understanding, the critical concepts, and I think some surprising insights needed to navigate the complexities of gender today.
The goal is for you to feel equipped, not overwhelmed.
Exactly. Equipped to understand the nuances of the entire conversation. Okay, so let's unpack this. If we're going to dive deep, we have to establish a rock-solid foundation because, particularly in the United States, the terms sex and gender are used interchangeably all the time.
All the time.
And they are fundamentally different concepts. We have to respect that difference to have any kind of meaningful conversation.
Couldn't agree more.
So let's start with biological sex. Our sources define this as a classification assigned to individuals based on their biological, anatomical, and chromosomal characteristics.
And that classification is typically, and as we'll see, sometimes incorrectly assigned at birth.
Right. So what does that actually include? What are these components?
Well, when we talk about biological sex, we're really talking about a specific, tangible stack of components that an individual has. So this includes their chromosomes, the typical XX or XY, but as we'll get into, there are many variations.
Many variations.
Then you have the gonads, which are the testes or ovaries. Then the relative balances of hormones like androgen, testosterone, estrogen, progesterone.
So the chemical makeup.
The chemical makeup, exactly. Then the visible external and internal genitals. And finally, the emergence of secondary sex characteristics, things like body hair, voice pitch, or breast development.
So these physical and chemical markers are what the medical establishment uses for that initial classification at birth, that M or F on the birth certificate.
That's it. It's a snapshot of anatomy at a single moment in time.
So those are the physical facts. Now we pivot to gender, and this is where we really enter the realm of social science. Gender is defined as a social identity ascribed to individuals. And while it uses biological sex as its starting point, its true function is sociological. It dictates appropriate status, roles, and norms for behavior within that society.
And that distinction biological fact versus a dictated role is absolutely essential to grasp. Gender is, at its core, a social construct.
Okay, so what does that actually mean, a social construct? I think people hear that term and they think it means not real.
Right, which is a huge misconception.
Yeah.
Think about it this way. A social construct is an idea or a category that is created and accepted by the people in a society. It has no inherent physical meaning outside of that agreement.
Like money.
Money is the perfect example. It's a piece of paper or a number on a screen. But socially, we all agree it holds value. Traffic laws are just lines on the road and colored lights. But socially, we agree they dictate safe behavior.
So they have real-world power because we agree they do.
Exactly. And similarly, the definition of what a man is or what a woman is purely what society agrees upon in a given time and place. But, and this is the crucial part, these agreed-upon definitions, these roles and norms, have incredibly real-life consequences. They dictate everything from wages to political power to how someone is treated in a doctor's office.
And we can see those real-world definitions in what the source calls the social components of gender. It's everything you're taught and then what you enact daily.
Yeah, things like culturally appropriate clothing or ornamentation like makeup or tattoos.
The norms of behavior, like whether it's okay to cry in public or show anger.
The beliefs associated with your identity, the abilities you're encouraged to develop, or, just as importantly, discouraged from developing. And, fundamentally, the status you hold in society.
The total sum of all of these social expectations and tendencies is what sociologists mean when they say the social construction of gender. It's the whole package.
It is the whole package.
So, since this language is so critical for clarity, let's quickly nail down 3 core terms we'll be using a lot. First, gender identity.
This is one's innermost, deeply held feeling of self, whether that's maleness, femaleness, a blend of both, or neither. And, crucially, this internal identity may be the same as, or may be vastly different from, the sex that was assigned at birth.
Next up, gender expression.
So this is the outward, external way a person communicates their gender identity to the world. You see this in their appearance, their dress, their body language, their behavior.
And it's important to remember that this expression, it may or may not fit into those traditionally defined masculine or feminine ideals, right?
Absolutely. Our goal here is to consistently show that expression, identity, and biology all exist on a continuum. They're not just two opposite points.
And finally, a term that's vital for understanding the background pressure cooker of our society, heteronormativity.
Right. This is that pervasive societal view that promotes heterosexuality. So attraction between two people of the opposite gender as the normal, the preferred, and kind of the default sexuality.
It doesn't just pertain to who you date, right? It's bigger than that.
Much bigger. It includes all the expected behaviors, the family structures, the life paths, everything that gets framed as the default straight experience. It's the water we're all swimming in.
Okay. So we've established gender as a social construct, an agreed upon role. Now let's look at the mechanism of how that construct gets layered onto people, starting at day 0. The gender identity ascribed to a person is imposed immediately, often through these obvious visual and social cues that are, virtually impossible to ignore.
It's so pervasive. The source material highlights this with a really simple comparison of 2 infants. One is immediately clothed in a pink frilly swimsuit, and the other is in a blue dress shirt with suspenders.
Yeah.
And societally, we equate that biological sex with a gender through this immediate forceful application of markers. The specific name that's chosen, the style of haircut, the decoration of their room, the types of toys they're given.
And most famously, the color scheme. Blue for male, pink for female. It's almost a caricature at this point.
It is. And these initial cues are so powerful that they have given rise to this whole cultural ritual we now know as the gender reveal party.
A phenomenon which is actually brand new.
Very new. It involves parents disclosing the biological sex of an unborn child, often through these really elaborate spectacles. Cutting a cake to reveal pink or blue filling, setting off colored smoke bombs or fireworks.
And it acts as a public social assignment of gender before the child has even drawn its first breath.
And this cultural ritual is a perfect illustration of that social construction process in action. The trend itself only began in 2008.
2008. That's it.
That's it. It was started by a blogger named Jenna Karvounidis. She just wanted a unique way to announce her baby's sex. And yet, that one single blog post catalyzed this massive global phenomenon that now puts immense pressure on a single aspect of a person's identity, their biological sex, and equates it instantly with their expected gender role for life.
And here's where the human element just complicates the whole social pressure thing. Karvounidis herself, the originator of the trend, has publicly expressed regret over the cultural monster she created.
I saw that.
She noted recently that the child whose sex she announced with that very first cake now wears suits and actively goes outside gender norms, which just proves that the biological assignment made at a party has very little to do with the complex lived identity of a person years later.
And the consequences of this pressure cooker environment environment are visible in the headlines, right?
Hmm.
We've seen reports of gender reveals that go horribly wrong, moving past just social awkwardness into genuine physical damage,
Oh, yeah.
including, famously, one where fireworks set off a massive wildfire. This just shows the high-stakes, almost feverish importance society has placed on enforcing this binary expectation from the very beginning.
It's fascinating how quickly a simple cultural practice can become an entrenched institution. And this brings us to the foundational sociological work of Judith Lorber. She articulated the core mechanisms of gender as a fundamental social institution.
For Lorber, gender isn't just a role, it's a three-part system of control.
Okay, what are the three parts?
So first, she defined gender as a process. It's the ongoing creation of social differences that define what it means to be a woman and what it means to be a man within a specific culture. It starts with those pink and blue cues and continues daily through social reinforcement.
A process.
Okay, second, gender is a system of stratification. Within most historical and modern Western contexts, this system inherently ranks men above women. It provides men with greater access to resources, to power, and to authority. The process creates the categories, the stratification ranks them.
And the third part.
And third, gender is a social structure or institution itself. It's one of the major ways individuals organize and understand social life. It dictates everything from who changes the diapers to who holds political office. When you look at any large-scale societal organization, the economy, politics, religion, gender is one of the primary foundational pillars of that structure.
So the mechanism of reinforcement, that's where the system really gets its power, right?
Exactly. Lorber explained that once a child's gender is evident, everyone else starts treating those in one category differently from those in the other. And the children, in turn, they respond to this differential treatment by feeling different and behaving differently.
And then they internalize it.
They internalize it, defining themselves as members of that gender. And this is how the system becomes self-perpetuating. It's a feedback loop.
I mean, think back to your own childhood. Did you ever feel that subtle but distinct pressure to play with certain toys or adopt certain language or express emotion in a specific way based on the gender category society had assigned you? That pressure is the process of gender creating and continually applying its definition to you as you enact it.
Which brings us back to the specific language we need to navigate the world accurately. The term transgender, or trans, is used when one's internal gender identity does not align with the sex assigned at birth. This term has been in use since about the 1970s.
And its necessary counterpart, cisgender.
Right, which means that one's internal connection to gender matches their sex assigned at birth. That actually came much later, in the mid-1990s.
Which is so telling sociologically. The dominant group only needed a label after the non-dominant group defined itself.
Exactly. And while the vast majority of people identify as cisgender, the trans community in America is significant. Our sources estimate 1.6 million adults, that's about 0.5% of those 18 and older, and 1.4% of the youth population aged 13-17 identify as transgender.
And it's just so crucial to understand that identifying as trans is not reliant on medical intervention.
Not at all.
Trans individuals may or may not seek medical treatment to change their secondary sex characteristics or biological sex through hormone treatments or surgery. The gender identity and expression are complex, and as we noted, there are so many non-binary variations along that spectrum.
The internal sense of self is the core defining factor, period.
Okay, here's where it gets really interesting and, frankly, critical for any informed discussion. Once you accept gender as this deeply entrenched social construct, it provides the lens necessary to confront and dismantle some of the most common and harmful myths surrounding sex and gender.
Myths that are constantly being used to justify restrictive, often discriminatory, social and legal policies.
Absolutely. The academics we studied, they zero in on 4 foundational falsehoods that need to be dismantled.
Okay, what are they?
1, the myth that sex is a single trait. 2, that sex is binary. 3, that genitals equate to gender. And 4, that gender is a psychological choice.
Let's tackle the first two together. The myth that sex is a single trait and the myth that sex is binary. I mean, this is just refuted by basic biology.
It really is.
As we briefly mentioned, biological sex is made up of multiple components: chromosomes, gonads, hormones, and external anatomy. A person can have different, sometimes conflicting components of those traits.
Can you give an example?
Sure. For instance, a person might have the typical male XY chromosomes, but due to a condition like androgen insensitivity syndrome, their body doesn't recognize testosterone effectively. So they end up developing primarily female external characteristics. Or they might possess both a penis and ovaries.
So the existence of these real, scientifically acknowledged combinations means that biological sex is not a simple choice between M or F.
It cannot be. It is a spectrum. If there are multiple combinations of chromosomes, hormones, or anatomy, then sex fundamentally cannot be binary. A binary understanding is a gross oversimplification that, academically just invalidates a significant portion of the population.
So that brings us to the third myth, the idea that genitals equate to gender. This is where we see the most profound political harm. Yes, genitals are a biological sex component, but as we've established, gender is a social construct. Insisting that a penis inherently makes one a man and a vagina makes one a woman is so damaging because it completely bypasses the internal identity.
And it becomes a tool of social intrusion and exclusion.
Exactly. And we are seeing the real-world harm of this belief play out right now in school policies and current legislation concerning sports participation.
Oh, absolutely.
Our sources highlight the dangerous consequences of laws passed in states like Ohio and New Jersey, which have provisions allowing school staff and sports coaches to perform what are essentially genital checks on students or players to decide if they can participate in gendered sports, like girls' basketball.
It's horrifying.
Yeah.
It's a policy designed to enforce the binary based purely on the visible status of one body part. They're essentially demanding an examination of a minor's private parts to affirm if the player has a vagina. If they don't conform to the assumed definition, they're barred from participation.
This isn't about competition. This is about social control.
That's all it is.
Yeah.
And the deep implication here is the violation of bodily autonomy. These policies involve a gross and unnecessary invasion of privacy, and worse, they carry serious risks of sexual assault or abuse.
You're treating human anatomy as a means of social exclusion and moral policing, rather than acknowledging the complexity of the biological and social self.
Precisely.
Which brings us to the fourth myth, that gender is a psychological choice. This suggests that someone just wakes up one day and decides to change their identity.
Right, framing gender nonconformity as this conscious decision that could be reversed with enough effort. This notion is incredibly rampant in anti-LGBTQIA plus political rhetoric.
But let's just use the challenge put forward by the source material. When did you, the listener, decide that you aligned with your biological sex? If you are cisgender and have never, ever had to allocate brain power to thinking about whether your gender aligns with your biological sex, that convenience, that freedom from concern, that is the definition of privilege.
Absolutely. Those who are gender nonconforming have to allocate massive amounts of energy, time, and emotion just to figure out how to fit into the world safely, which powerfully refutes the idea that this is some casual choice.
And beyond that, medical professionals just don't support this idea.
Not at all. Psychologists and medical professionals across all specializations strongly refute the idea that gender identity is a reversible choice or a disorder that needs fixing, for example, through harmful practices like conversion therapy.
But what about gender dysphoria? People hear that term and think it's a diagnosis of a mental illness.
And that's a common misunderstanding. While the diagnosis of gender dysphoria exists and refers to the intense feelings of struggle and distress about the mismatch between one's biological sex and gender identity in most contexts, this term is used within the medical system simply to validate the patient's need for support and medically assisted transition. It's not to categorize their identity as a curable pathology. It's a key to get care.
It's a means to an end within a rigid system.
Exactly. And to further illustrate the sheer complexity of biological sex, we have to look at how the medical community has already acknowledged the spectrum.
Okay.
Back in 1995, a pediatric endocrinologist named Charmian Quigley developed the Quigley scale.
The Quigley scale. Tell us more about this. Why is it so significant?
The Quigley scale was designed to clinically map the acknowledged range of normal infant genitalia for those with intersex variations. It ranges from a fully masculinized presentation, which is scale 1, all the way through to a fully feminized presentation, which is scale 6 or 7.
So wait, a scale with multiple points, not just 2 boxes.
Not 2 boxes. The fact that medical practitioners needed a detailed 7-point scale just to categorize the range of normal physical presentations in infants demonstrates conclusively that biology itself is far from a rigid binary.
So the binary is an administrative category, not a scientific reality.
That's the perfect way to put it.
I find the next anecdote in the source material truly stunning, and it profoundly supports the argument that gender is socially reinforced, regardless of the internal biological reality.
It's an amazing story.
So imagine this scenario. A 46-year-old pregnant woman in Australia goes to a clinic for an amniocentesis. The baby's healthy, but follow-up genetic tests on the mother reveal an astonishing truth about her own internal makeup.
Mm-hmm.
Her body was built of cells from two separate, merged twin embryos. One set of cells carried two X chromosomes, the typical female complement, and the other carried an X and a Y.
So she was a chimera.
Exactly. Halfway through her fifth decade, and having successfully conceived and birthed multiple children, this woman learned for the very first time that a large, substantial part of her body was chromosomally male.
And yet she had appeared, lived, and functioned reproductively and socially as female for her entire life.
It's the ultimate scientific proof point that society defines who you are based on external interpretation.
Absolutely. Even with such fundamental internal biological complexity, the woman's assigned gender, her social roles, her identity, it was all entirely based on the external interpretation of her body at birth, which was then continually reinforced by decades of social interaction.
The biological reality was completely secondary to the social reality.
It was irrelevant until a specific test found it by accident.
Moving from the pure biology and the stunning realities of the chromosomal spectrum, we now need to shift our focus to the institutional systems that actively work to enforce that binary structure, and specifically, the medical system.
This brings us to the concept of medicalization. And simply put, this is the process where a human condition, a behavior, or a set of characteristics becomes systematically studied, diagnosed, and treated by the medical field.
And our source material notes that medicalization impacts all genders, but it becomes a really potent tool of marginalization when it's specifically used to force non-conforming bodies and identities into a strict binary structure.
And the most tragic victims of this enforced medicalization are intersex individuals.
Right.
As we discussed, intersex is an umbrella term describing variations in sex characteristics, chromosomes, hormones, genitals, that simply do not fit the typical cultural definitions of male or female.
And the source highlights a specific example, Klinefelter syndrome, which means possessing one Y and more than one X chromosome, so XXY. The complexity immediately arises. Is this person male? Is this person female? Chromosomally, anatomically, hormonally, they fall outside the culturally comfortable boxes.
And this is not a rarity. The Intersex Society of North America estimates that 1.5% of people have sex variations. That's roughly 2,000 births a year in the U.S. alone.
So if this is a natural human variation, why is it still so largely unknown or treated with such shame?
The answer lies in the historical and ongoing practice of non-consensual medical intervention. Our sources detail this heartbreaking reality. Individuals born with genitalia that are not easily classified as male or female are frequently subjected to genital surgeries during infancy or early childhood.
And these are called normalizing surgeries?
Yes. Surgeons perform these procedures to literally construct and reconstruct individuals' bodies to fit into the dominant binary sex-gender system. For example, if an infant has a genital appendage that is smaller than 2.5 centimeters, surgeons often reduce the size and perform operations to assign them female, regardless of the child's chromosomal makeup.
So wait, the source is suggesting that doctors are essentially performing irreversible, non-essential cosmetic surgery on infants based purely on cultural discomfort with ambiguity.
That is precisely the implication. And while parents and doctors often try to justify this practice as being in the best interest of the child, usually citing a fear of social ridicule later in life, the outcomes are traumatic and often devastating.
Because they're performed without the patient's consent.
Without consent, yes. And it leads to profound psychological distress later on, scar tissue disfigurement, chronic infection, and critically, often sterilization, which eliminates their ability to reproduce.
The sources draw a chilling link between these procedures and historical eugenics projects, noting that these practices were aimed at ensuring intersex people remained invisible and couldn't propagate their difference. It reinforces shame, secrecy, and a sense of betrayal surrounding their bodies.
And this treatment of intersex variations stands in stark contrast to historical views. The ancient Greek god Hermaphroditus, for example, was depicted as having both male and female attributes. And in some parts of Asia, intersex individuals were historically celebrated or seen as special, holding a unique social status.
It's a powerful example of how culture, not biology, dictates medical intervention.
And this pervasive enforcement of the binary also manifests as widespread gender inequality and bias within medical institutions against all marginalized genders. For women, there is this persistent issue of struggling with gender bias, where medical professionals are less likely to listen to them or assume they can't make rational decisions.
And it's so ingrained that a federal law was required for this.
Yes. In 1993, a federal law was required to mandate that the National Institutes of Health include women and minorities in clinical research, simply because diagnoses and treatment of women's illnesses were historically slower and fewer than men's. The fact that a law was needed is just damning evidence of systemic bias.
And the consequences are terrifyingly specific, especially when it comes to pain.
Yes. Women experience chronic pain significantly more than men, but they are far more likely to be diagnosed with a psychological or emotional reason for that pain like hysteria or anxiety rather than a physical one. Doctors are less likely to believe their pain reports, resulting in women receiving less effective pain medication or being treated for mental health instead of physical health.
And this trend is compounded exponentially when we apply the lens of intersectionality.
Absolutely. Women in the BIPOC community, Black, Indigenous, and people of colors, struggle with compounded bias. They experience unreliable diagnoses, significantly poorer pregnancy and childbirth care outcomes, and diminished access to pain management. Research shows women with complex autoimmune diseases like lupus or endometriosis are often labeled as overly dramatic complainers, and their efforts at diagnosis are routinely dismissed, often for years.
Now, conversely, the system's biases affect men too, though in a different way. While men reporting chronic pain tend to receive stronger pain management and are more likely to be believed, they suffer under the weight of hegemonic masculinity, which we'll discuss shortly.
That pressure to be strong and resilient means that men delay care, they withhold crucial information from doctors, and they ignore debilitating health symptoms, especially regarding mental health.
And the source material attributes this rigid adherence to masculine roles as a primary reason why the suicide rate is so much higher for men than for women.
So much higher. Specifically, the rate is highest among middle-aged white men, who accounted for nearly 70% of suicide deaths in 2020. Men died by suicide 3.88 times more than women in that same year.
And it's because they delay medical intervention and withhold information, particularly about mental health, because admitting pain or emotional vulnerability is viewed as a betrayal of their gender role.
The medical system is complicit in enforcing the norms that end up harming the dominant group.
Finally, we have to look at the severe marginalization of the transgender community in healthcare. Trans and non-binary individuals face a massive wall of major obstacles. Explicit bias, crippling economic barriers, insurance refusals, staff who are untrained or actively hostile.
And the omnipresent fear of discrimination or hate crimes when seeking care.
Access to gender-affirming care is extraordinarily difficult due to these compounded barriers and the sheer expense.
And on top of that, trans individuals seeking this care are often required to be diagnosed with gender dysphoria, a medical process that, while validating their need for support, simultaneously results in categorizing trans identity as a mental disorder within the established medical framework.
This bureaucratic process is often called gatekeeping, right?
Right.
Where access to or information about their own health care is controlled by medical professionals or institutions.
Exactly. And it disproportionately affects trans people, forcing them to delay necessary, often life-saving care. And of course, there are the political barriers. We've seen a recent wave of state-level bans on gender-affirming healthcare for transgender minors, like the bans passed in Alabama and Florida in 2021 and 2022.
These are all powerful examples of the system actively working to enforce the binary and exclude those who do not conform.
It's systemic.
So, what does this all mean? We've looked at the confusing biology, the immediate social imposition, and the profound medical and institutional consequences. Now let's connect it back explicitly to the idea that gender is a social construct that maintains a power structure. I think the analogy the source material gives is brilliant for illustrating how social constructs are maintained only by constant agreement. Think about a standard wooden table.
Yeah.
In a normal setting, its meaning is purely utilitarian, a place for writing, eating, socializing. But suddenly, you hear noises down the hallway and you realize you're in a zombie apocalypse. That table's inherent meaning is nothing, but its function shifts entirely.
It immediately becomes a barricade, a shield, a weapon.
Its social utility changes instantly based on the new social reality, and gender roles are no different. The source rightly asks us to consider the apocalypse. Would the clothing, roles, and expectations of gender remain the same?
Absolutely not. Wearing impractical clothing or prioritizing dominance over necessary labor skills would be instantly detrimental. The social value of what is deemed masculine or feminine would drastically shift based on survival needs.
So this societal organization is best explained by Raewyn Connell's foundational concept of hegemony.
Hegemony, yes. It's defined as the political, economic, or cultural influence or authority held by a dominant group, in this case, men over others. And this authority isn't based on physical force alone, but on cultural consent.
And this leads directly to the idea of hegemonic masculinity.
Right. This is the ideal, the standard all men are measured against. Hegemonic masculinity pressures men to uphold certain highly rigid gendered expectations and qualities to ensure their ongoing dominant social position.
So men are expected to actively reject feminine qualities, roles, and displays of weakness to maintain this status.
Exactly. And the traits associated with current constructs of hegemonic masculinity in America are pretty clear. Authority and dominance, economic stability, being the provider, educational and labor market success, and critically unchallenged heterosexuality.
This idealized image, the stoic businessman, the aggressive athlete, the emotionally impenetrable father, this is what grants status and power.
It is. And as we touched on earlier, while it appears to only benefit men, these rigid expectations are deeply harmful for boys and men. The pressure to be unemotional, financially dominant, and physically strong leads to severe health avoidance and the mental health struggles we detailed.
And the societal cost of failing to meet this ideal can be catastrophic. It can lead to feelings of inadequacy, isolation, and, as reflected in those alarming suicide statistics, tragic self-harm, especially during economic downturns when that provider role is threatened.
But the very existence of a high, rigid ideal means there are always alternatives and subordinates. Alternative masculinities exist more often in marginalized or subordinated populations, like working-class men, ethnic minority groups, or homosexual populations.
And since these groups already hold less structural social power,
Their enactment of masculinity tends to be more flexible. They often incorporate traits deemed feminine by the hegemonic standard because they can't access power through the traditional reps anyway.
then you have subordinate masculinities.
These are the labels applied to individuals or groups who actively do not embody the hegemonic qualities. Think openly gay men, poor men who can't provide, or some men of color who are culturally marginalized. They have significantly less access to resources and less power over both women and other men, precisely because they are judged and penalized for their deviation from the idealized traits.
Okay, so let's pivot to the flip side of the gender binary. Emphasized femininity.
Sometimes referred to as idealized femininity, yes. These are the traits society pressures women to embody, being nurturing, caring, emotional, passive, physically pretty, and thin.
And emphasized femininity represents a form of compliance with women's subordination, right? It dictates behaviors that accommodate the interests and desires of men.
It does. This version of femininity is typically enacted strategically in order to gain access to resources and power within the system, whether that's financial stability achieved by adhering to specific beauty ideals or cultural recognition gained through focusing entirely on successful mothering.
And mirroring the masculine structure, there are subordinate femininities.
Exactly. These represent populations who have less access to resources and less power because they do not embody that culturally emphasized femininity. This includes populations like lesbians, women in poverty, women of color who face different beauty standards, and women who simply don't conform to the cultural ideals of physical attractiveness or passivity.
So they're penalized for noncompliance.
They are. The core, profound takeaway from Connell's work is this. The binary ideals, hegemonic masculinity and emphasized femininity, are inherently toxic and limiting. They demand conformity to an impossible standard, and most people, in their outward expression and internal identity, fall somewhere in the middle, or entirely outside of these rigid roles, facing penalty and struggle as a result.
Okay, let's look at the highest level of complexity now, moving past simple stratification and into the deep mechanisms of identity. Our traditional binary ways of thinking, they assume only two categories for everything, male, female, white, black, straight, gay, and they assume these two categories are complete opposites.
And this oppositional binary thinking is highly strategic for maintaining power. By setting up the world this way, society defines men as not women, white people as not black, and straight people as not gay.
And this strategy ensures that the dominant groups are associated with more valued, positive traits like strength, intelligence, rationality.
While the subordinate groups, defined as their opposites, are always associated with less valued traits, weakness, emotion, your rationality.
But the social reality is so much more complex and nuanced. Identities aren't single boxes, they're multifaceted and overlapping. This brings us to intersectionality.
A concept often attributed to Kimberly Crenshaw, that our experience of gender is always shaped simultaneously by our race, our class, our sexuality, and every other aspect of our identity.
Can you give an example of how that works in practice?
Sure, if we look at the medical bias we discussed earlier. A white cisgender woman is subject to gender bias regarding chronic pain. However, a black trans woman faces not only gender bias, but compounding biases related to race and trans status. An intersectional approach gives us a much more complex and accurate understanding of how power imbalances and marginalization actually operate in the real world.
This realization that identity is a complex overlay is why we absolutely must move beyond the binary identities of man or woman. And this led to the popularization of umbrella terms like non-binary and genderqueer.
Right. For gender identities that exist beyond the traditional masculine-feminine definitions, genderqueer became popularized in the 1990s and early 2000s, while non-binary gained widespread use in the 2010s.
And a practical, daily manifestation of acknowledging these identities is the respectful use of pronouns, including gender-neutral options like they, them, or zihir.
And since one's identity and preferred pronouns are not visible on the body, trans communities have created this powerful social procedure, verbally asking and stating one's pronouns when introducing oneself. It makes the process of identity communication mutual and non-judgmental.
To give you a deeper appreciation for the thought behind these identities, let's look at the symbolism of the genderqueer non-binary pride flag, which was designed by Marilyn Roxy. The colors themselves are deliberate declarations of complexity.
The top stripe, lavender, represents androgynes and androgyny, as it's a mix of the traditional blue and pink. It also holds historical weight, as lavender has long been associated with queerness throughout history.
And the central white stripe represents a gender identity, the absence of gender.
It does.
But I find the final color the most sociologically powerful, the dark chartreuse green. Why this specific unusual shade?
Because it is the exact inverse of lavender on the color wheel. It was chosen specifically to represent those whose identities are defined outside of and without any reference to the binary. It's an active rejection of the pink-blue spectrum altogether, signaling a totally external self-defined category.
Now we come to some of the most radical and widely discussed sociological ideas in this field. Let's talk about Judith Butler's theory of gender performativity.
Okay.
Butler argues that gender is performative. But this is often misunderstood, isn't it? She doesn't mean that gender is simply a theatrical performance, like acting a role.
No, it's a subtle but crucial distinction. When you act, you are putting on a role. In Butler's performativity, the act creates the reality. By constantly performing the various roles and enacting the norms associated with gender, say, the pressure to dress a certain way for prom, or the expectation that a man must hold the door open, we collectively create the illusion of gender.
And that illusion is real only to the extent that it is performed and reinforced by social coercion or pressure.
Exactly. If we stop performing it, the illusion fades. And here is where Butler pushes the boundaries. She argues that this performativity is so powerful that it creates the reality of gender, and that it also retroactively informs the meaning of sex itself.
That's the radical idea.
It is. Butler argues that biological sex is not just a hard biological fact that exists independently. Rather, even the interpretation of our biological bodies, what a penis or a vagina means, is given meaning and weight through social construction and maintenance. Society looks at the biology and says, this must mean X, and then enforces X through constant performance.
Complementary to this is the concept of doing gender, developed by Candace West and Don Zimmerman.
Their theory suggests that gender is less about fixed internal roles and traits, like being innately maternal, and more about the continuous result of social practices, norms, and behaviors that are performed and maintained in our everyday moment-to-moment interactions.
So everyone, men, women, non-binary people, participates in doing gender daily, whether consciously or unconsciously.
Every single day. Every time we divide household chores by assumed gender roles, or every time a man interrupts a woman in a meeting, we are doing gender. The result of constantly performing and enforcing these social practices is that it powerfully reinforces the entire social structure, including the existing stratification and power imbalances.
So gender doesn't exist before the action. The action creates the gender structure.
That's the core of it.
These binary ideas about gender, this rigid enforcement of MF, masculine, feminine, are inextricably linked to how we view sexuality, which has also historically tried to fit itself into equally rigid boxes,
Yeah.
straight or gay.
hmm Let's discuss queer as an identity term. While it was historically used as a violent slur, the term was powerfully reclaimed by LGBTQIA+ people in the 1990s.
And today it serves as an encompassing umbrella term for all LGBTQIA+ individuals.
And, crucially, as a non-categorical sexual or gender identity for those who resist specific labels, it signifies a political and social stance outside of established norms. However, it's worth noting that some individuals still feel insulted by its historical context and prefer not to use it.
The push to challenge the binary in gender naturally extends to challenging the binary in attraction. Bisexual is typically defined as attraction to either men or women, but the term is sometimes criticized, right?
It is because, by definition, it implies a rigid binary approach to sexuality attraction to two sexes, which then inadvertently excludes individuals who do not identify strictly as men or women.
So this criticism, which highlights the spectrum of gender identity, led directly to the popularization of terms like pansexual.
Exactly. Pansexuality is defined as attraction to people of any gender or sexuality, explicitly acknowledging the full spectrum of identities we've been discussing throughout this dive, rather than relying on the traditional binary model.
And beyond attraction, we also see diversity in relationship structures that challenge the old heteronormative ideal of monogamous coupling. Polyamorous, or often shortened to poly.
Right. These relationships are non-exclusive. They're built on the foundation of multiple simultaneous, consensual, and individually negotiated sexual or romantic relationships. And the key component that's distinct from cheating is negotiation, honesty, and full consent among all involved parties.
And finally, we have the identity of asexual, often abbreviated as ACE.
This identity is marked by a complete or rare lack of sexual attraction, or consistently low or absent interest in engaging in sexual activity. And there's an important distinction here that's often missed.
Okay.
Asexual individuals meticulously distinguish between sexual and romantic attraction. They may be deeply romantically involved with someone, crave emotional intimacy, and form lifelong partnerships, but they may simply not be interested in or attracted to them sexually.
That's a really important distinction to make.
It is. We have covered an immense amount of ground, moving from chromosomes all the way to queer theory. Our mission was to provide you with a clear, thoroughly informed perspective on gender. And I think we accomplished this by establishing that gender is a flexible, context-dependent social construct, that biological sex is undeniably a spectrum, and that both identity and biology are deeply intertwined with power dynamics and profound marginalization within large systems like healthcare and law.
We moved from the simple, immediate social cues of baby clothes and gender reveals that enforce the binary to the complex, structural, sociological concepts of hegemonic masculinity, intersectionality, and Judith Butler's gender performativity. We've shown how our daily interactions constantly create and maintain a binary that fundamentally penalizes anyone who does not conform to the ideal standard.
The knowledge you now possess proves that gender is not inevitable. It is an agreed-upon structure.
And we'll leave you with this final, powerful, provocative thought, drawn directly from the historical accounts mentioned in our sources. Anthropologists found documentation that 33 distinct Native American groups in North America had women warriors, sometimes called Amazons, who were selected from childhood to be treated like a man, dressing, hunting, and fighting as males.
That's incredible. So in tribes like the Casca Indians, if a married couple had too many daughters and the tribe needed hunters, they would specifically select one daughter to be raised in this role.
Right.
She would begin dressing like a boy and performing male tasks at around 5 years old, ensuring she would become a capable, respected hunter.
So if gender roles and expectations, the very definition of masculine versus feminine behavior, down to dressing and hunting and status, can be entirely flipped based on a tribe's needs or a shift in social reality. What does that tell you about the inherent fixed meaning of the gender expectations you experience today, and how quickly those expectations could shift if our social reality were suddenly challenged or fundamentally transformed?
Something to think about.
Something to mull over until our next deep dive.